Welcome to This Explainer. Today, we're diving into a really comprehensive, systematic review to uncover exactly how to fix the massive physical toll our screens and modern lifestyles are taking on our bodies. If you spend hours at a desk or just staring down at your phone, pay close attention because the science on how to reverse this damage is absolutely fascinating.
But hey, before we look at the data, let's do a quick posture check right now. Are you slouching or maybe pushing your head forward while listening to this? Don't worry, absolutely zero judgment here. But this exact posture is what researchers are increasingly calling text neck, and it is taking a massive mechanical toll on your spine.
Now, if you just suddenly adjusted your posture, you certainly aren't alone. In fact, a staggering 60% of students and office workers suffer from this modern epidemic. I mean, our prolonged static postures and, let's face it, pretty poor ergonomic setups have made this incredibly common. It's turned into a widespread musculoskeletal issue that we really need to actively address. So, scientifically speaking, this misalignment is called forward head posture, or FHP. To put it simply, it's a postural deviation where your head translates anteriorly, which is just a fancy way of saying it shifts forward way out of its natural healthy alignment with the vertical plumb line of your body.
But why does that shift actually matter so much? Well, get ready for a jaw-dropping statistic straight from the research. For every single inch your head moves forward out of alignment, it adds 10 pounds of extra weight to your cervical spine. Seriously, imagine holding a heavy bowling ball slightly away from your chest all day long. That is exactly the kind of leverage and strain your neck is fighting right now.
And this massive extra weight? It creates this dangerous, exhausting muscular tug-of-war in your neck and shoulders. It's a biomechanical disruption that totally ramps up the compressive stress across your vertebrae. Over time, this chronic strain snowballs into muscle fatigue, restricted mobility, those awful tension-type headaches, and eventually, even disc degeneration and nerve compression. No thank you.
Now, this tug-of-war creates a very specific muscular imbalance. Essentially, your muscles get locked into two completely opposite dysfunctional states. On one side, your deep cervical flexors and lower trapezius just get weak and lazy. And on the other side, the superficial anterior muscles, like your pectorals and that SCM muscle in your neck, become super tight and shortened. They literally lock that bad posture into place. So, to figure out exactly how to win this tug-of-war, researchers conducted a rigorous, systematic review published in the International Journal for Multidisciplinary Research. They started with 437 potential records, and using strict methodological screening, narrowed it all the way down to 27 high-quality clinical trials. Their goal? To find the absolute best evidence-based physical therapy solutions.
Step 1. Strengthening weak muscles. Let's dive right into the first part of this evidence-based solution, which is all about waking up those underused, weakened muscles.
To really correct forward head posture, you have to specifically target your deep neck flexors, namely the longus colli and longus capitis. I know, big words, but these are vital for maintaining and restoring that natural cervical curve in your neck. At the same time, you've got to strengthen your scapular stabilizers, like your middle and lower trapezius and the serratus anterior. These are the muscles that physically pull your shoulder blades back and down into a healthy, stable position. And the clinical trial showed amazing results from a highly specific technique called craniocervical flexion training. Basically, patients used a pressure biofeedback device right beneath their neck to ensure precise motor control. The evidence is super clear here. Maintaining 20 to 30 millimeters of mercury of pressure and doing these exact movements 5 times a week while progressively increasing the load results in some serious, lasting postural correction.
Step 2. Stretching tight muscles. Because here's the thing, strengthening alone just isn't going to cut it. We have to handle the other side of that muscular tug-of-war we talked about earlier. We absolutely have to release the physical tension that's actively pulling your head forward, and that means systematically stretching those shortened, overactive anterior muscles. The research specifically highlights the pectoralis major and minor in your chest, the levator scapulae, and that SCM muscle in the front of your neck as the primary targets for myofascial release.
Okay, so how often should you actually do this? Well, the most effective static stretching routine prescribed in these successful studies is strict, but it's simple. For optimal results, you need to hold these stretches for 30 to 45 seconds, complete 3 to 5 repetitions per session, and do all of that 3 times a day. Seriously, consistency here is absolutely critical if you want to reverse that chronic muscle shortening. Now, if you want even better flexibility gains, and who wouldn't, the research highlights a highly effective technique called proprioceptive neuromuscular facilitation, or PNF.
By utilizing PNF hold-relax methods on those tight anterior shoulder and neck muscles, studies showed a 25 to 30% improvement in range of motion compared to just standard static stretching alone. It is an incredibly powerful tool to accelerate your progress.
The winning posture strategy. Because the crucial point here is what happens when we consistently combine these two modalities into one unified daily routine. When put to the test, the clinical outcomes of a combined approach are genuinely exceptional. Patients who integrated both the strengthening and the stretching saw their craniovertebral angle, which is the primary clinical measure of head alignment, improve by 8.5 up to a whopping 15 degrees. Even more impressively, their neck disability index scores dropped by a massive 35%, reported pain levels went down by 22%, and their cervical range of motion increased by up to 30%.
So the ultimate takeaway from all 27 clinical studies is crystal clear. Multimodal approaches yield superior results compared to single-modality treatments. Doing just to stretching or just to strengthening, it simply won't fix the root problem. You need the synergistic effect of both. You strengthen to improve motor control and spinal stability, while simultaneously stretching to relieve tightness and restore your range of motion. That is the true secret to permanently correcting your alignment.
Which brings us right back to where we started. Whether it's utilizing a biofeedback unit for your deep neck flexors, committing to those daily doorway stretches for your chest, or just being hyper-aware of your screen time, the science shows that true correction is entirely possible. Knowing the literal weight of this problem on your spine, that every single inch of forward shift adds 10 pounds of damaging strain, what habit are you going to change today to finally sit up straight?